That's all right. I'll go by what we have in our morning call this morning. So our EOC staff has been meeting every morning, 9 o'clock. You all invited to that call. You've heard some of them. A lot of good work is going on. From Bill Webb this morning from the health department, the latest numbers we have in Kent County, where we have 12 positives. We had one yesterday. And last I saw on their website was 91 negatives. So we had 91 people that tested negative, and those numbers keep rising too, so that's good. But we have 12 positives as of yesterday afternoon. The hospital surge task force, statewide task force, is doing good work. I think they narrowed it down to where we're going to be, where our hospital surge will be on the Upper Shore. I think we have a meeting tomorrow. Is that right, Shelley? With the surge task force to finalize that, and we'll be able to announce that once that's done. I think there's going to be 2 locations on the shore, one down in Salisbury and one up here somewhere. And we'll be able to announce that tomorrow. Working with the hospital, with the University of Maryland Shore Regional Hospital. So that'll happen tomorrow. We're working on a feeding plan. Rosie is heading up, Radio is heading up our feeding plan, and we'll have those first meeting for that task force meeting on Thursday. Includes volunteers and LMB. What else is there, Shelley? Social services.
The Social Action Committee.
Social Action Committee, but as volunteers. So
and several of our restaurants.
Yes, and she announced that this morning. Rosie did this morning. I think there was 4 different restaurants that have been involved as volunteers in feeding our citizens, our senior citizens. Actually, I think it was about 80 meals they prepared. So that's going well, and that's going to be ramping up too as we get further into this. What else did we have on our call? Of course, law enforcement's on there. They're all doing well. They're kind of pulled back a little bit on what their efforts are right now. We're all waiting for PPE to arrive, personal protective equipment. That's been the key for everybody across the state. We've been getting a little bit drafts here coming, but I'm sure most of it's going to the bigger counties who have more cases. But we're doing okay. We're not in any critical right now. Some of our health care facilities are getting a little low on stuff and getting critical, but Bill Webb announced that they had some deliveries that they think is coming in today to help that.
Economic development.
Yeah, we had Jamie on for our EOC. Jamie was on for our EOC call for the first time this morning. Kind of looking forward to recovery. So she got on there and talked about all the programs that are available for everybody's individuals and businesses. So that was a help to get out. And she's been doing regular calls on Fridays with the Chamber of Commerce. That's a big help too. She's getting information out on the federal programs that are available. And what else should I?
All that information is available on our website.
Yeah. You can see the website, the health department website for updated information on the numbers for COVID-19. And then the county's website and emergency services website for any information. And the health department is still staffing their information line at 778-1350. That's available from 8 to 4 every day. So I can take any questions from you, gentlemen, about anything I might have missed.
Wayne, one of the things, I think I read someplace where 2 of those 12, I guess now, has been, they've been released or they've recovered. So I guess, I don't know whether the media on television talks about that or not, but there's not 12 active cases now. I guess to be honest, you would have to say we have 10 active cases.
Yeah, I think it's 3 now, Ronnie, that have been released, that have been treated and released in our past. Many of our numbers were early numbers that would go back to 3 weeks. So those people have gone through 14 days of this, and some people are coming in recovery and are done. I think that number is 3 now. So like you said, we don't hear that often.
Where are we with the idea of wearing masks in public? What are you expected to do and not expected to do? Because I hear some conflicting. Some people are wearing masks when they go outside. Some people, you see them not. Do we have enough masks? How about our employees? I think I know, like the detention center guards they're in a confined building. I think they wear masks when they're on duty, don't they? They
do. And the mask now, as of the beginning of last week, the recommendation from the CDC was anytime you go out in public is to wear a mask. And it doesn't have to be a first responder N95 mask. It just needs to be, it can be a homemade mask or it can be a dust mask that you wear when you're working in your shop or something. And the masks are not to protect yourself from getting the virus.
Right.
The masks are if you have to be carrying the virus and you're asymptomatic and don't know it, it keeps you from spreading the virus to others. So we're doing this to protect others so that they don't get sick and go home and get somebody else sick who's in one of those high risk zones.
I'm just wondering is when and none of us know when this is going to happen, but when we start to transition ourselves into being more open and going, there may be a need for that to make sure people are then wearing masks more than probably now. And do we have enough surgical masks available?
For now, we do. If we're talking about N95 masks.
No, I'm not talking. I'm just talking about surgical mask.
So it doesn't have to be a surgical mask. It can be a homemade mask, and that's what we're seeing a lot of. A lot of people are sitting at home and making masks and getting them out. We get offers for our people for masks, and we can't use them for EMS, but we're pointing these people who are making these masks to people who can use them. So I think that won't be a problem, Commissioner. I don't think that'll be a problem for these masks that are worn in public to protect others from.
Hospital and all is okay with
everybody's doing okay now. It would be nice if we had months of supply. Right now we're at weeks, but we're told by MEMA that we have some stuff coming in, and we should be seeing some more of it in the next couple of days or so.
Well, the only thing one of the reasons for bringing it up, I'm just curious. When I go, and I don't go out of the house much, to be honest with you, but when I do, am I expected to wear a mask?
Yes. Yes. It would be the humane thing to do these days would be if you're going out in public and you're going to be in contact with anybody, if you're going to go to Tractor Supply and buy some dog food for your dog, the thing to do would be to wear a mask so you're protecting other people from what you may have.
Well,
so, yeah.
I'll leave you with this, and it makes no difference to me because it's got nothing to do with me at all. But if we get to the point where I could put you in touch with someone that is receiving a very large shipment of surgical masks, if they're of any need to us, and it's a family member of mine that just let me know they're from up in the cities that's available. If we did, I don't know whether we need them or don't care. I mean, but if it's something we would like to have, or the hospital or can't get a hold of, I do have a contact I'll put you in touch with.
I'll keep that in my back pocket.
Okay.
Callers that have called into the bridge, please move your phones. Thank you.
One of the issues that we're dealing with on a daily basis, several times a day, is we're getting solicitations from people who are selling all kinds of different PPE, and we have no way of vetting them. I mean, we want to be able to bring things into the county that we might need, and most of it is shelf stable for a long time. So we could bring it in if we didn't need it now. We could maybe use it in the fall or use it in the future. But we don't know if they're scams, and that's the problem now. We don't know if they're scams or if they're inferior products. We get messages that hospitals in Virginia have bought $2 million worth of PPE, and when they get it in, it's junk. So we're being real careful. Right now, MEMA has an approved vendor list that we're going off of, so a lot of those things we're kind of ignoring, even though some of it looks interesting that maybe we could bring into the county and have for us. And some of them want you to buy 10,000 units at $6 a piece, and we just can't do that. But we're sending that stuff through to the state and having them vet them and see if they come back. But our normal vendors, our normal EMS suppliers don't have it, so to me that shows that probably what's out there might not be the best for us to use. But I will keep that in my back.
I'll put you in touch. I'll give you that contact, and then you use it however you think.
And the specs on things like that are not near as stringent as they are on the mask that EMS providers use in the hospital.
I'll call you after the meeting, and if you use it, fine. If you don't need it, that's fine with me. I just wanted to make sure that I pass that information.
The hospital is requiring now, it's a requirement for anybody that enters a hospital, whether you're a patient, a provider, or a visitor, or you're going in for an appointment or something, that you have to have a mask on to go in the hospital. And they have a supply of them sitting at the front door so if you go in. So a lot of places are going to be like that, especially healthcare. So
I can just imagine that when we do transition into trying to open things back up a little bit, however cautiously that's done, that masks may be something that we have to have to make people feel a little more comfortable.
I hate to think that we have to go through the summer like that, but it might turn out to happen. It might turn out to happen.
Well, we've been very fortunate, and I know that my colleagues and I all appreciate the job you all done, I tell you that what you see, nurses and doctors and nurses are just the unsung heroes today.
It is incredible what they're doing. I have some family members that are doing it, and to talk to them, once or twice a week, it's just incredible what they're seeing and the stress they're working under, but they're getting it done, and God bless them.
Well, how about it?
Yeah. But it even goes to, you go to the store and you try to have an interaction with a normal person at a store to buy something that you have to sustain your life, and the interactions with other people are it's just weird now. You don't know what
it is, and you're being asked to do things that you don't normally do. I mean, it's just natural when you walk up to somebody, or if they need help or whatever. It's just a different world we're living in today.
It is.
But Kent County, I think, is very, very lucky, and we may take things a little bit too much for granted because we are so rural, and right. I don't know, but it's troubling times, really.
It is, and sometimes I think people think that our cases are just in Chestertown, and that maybe some of the outlying smaller communities aren't being affected, but it's not true. So everybody needs to follow the guidelines and get us through the next few weeks, and then we can take an evaluation then, and hopefully we'll see somebody at the end of this tunnel. So.
Well, thank you.
Are we participating in the cases by zip code?
We are, but you have to have 9 cases in the zip code for it to show up on the site, so that we're not pinpointing.
I was working at Queen Anne's last night and nothing showed up, which meant there wasn't 9 cases in one particular zip code.
Yes, that's probably why.
Aren't most of our cases in the 21620?
Yes.
I mean, I looked that up last night.
Yeah. I believe 21620 is showing a number. I
think it was showing 9.
I think it was showing 9.
I think it's a low number.
Right.
But the caution there is that includes parts of Queen Anne's County. Yeah. So if you were to only use the Kent County part of that, I don't believe it would be enough to show.
Okay. Yeah. Well, I mean, I can't duplicate what Ronnie said. We certainly appreciate everything you're doing. The healthcare workers, I mean, it's just, they're essentially putting their lives at risk in a lot of cases, and I think the county, I think everyone in this county appreciates what's being done.
And the health department too, we're working on, we've always had really good relationships with them, but the amount of work they're doing compared to what they normally do, and Mr. Webb hasn't been in the job for very long, but they're doing an incredible job over there, and the pressure's on them right now. It's and they're up to it, and they're doing a really good job. So I appreciate everything that they've done for us in leading this effort. So
no question, that's for sure.
Yeah, really appreciate it.
It's tough times right now. You have to make some decisions. Sometimes it might not be the most popular, but everybody's just got to be a little patient with that because it's a different world we're living in.
It is.
Thank you very much.
Thank you. And we appreciate you coming in short notice. And
we were able to hire some part-time EMTs that are starting. Actually, one started today.
Okay.
So we'll get those on board. I don't know if you knew it or not, but we're actually in Rockwall and Galena from 7 a to 7 p.m. We are staffing their ambulance instead of the volunteers in order to keep the volunteers safer. So we have an EMT and a paramedic on each ambulance every day. The rescue squad has lent us an ambulance to use in Lynch to run the center of the county. So when we have that third EMT available and a paramedic there, we're going to take the ambulance out instead of taking the chase vehicle with just a paramedic. So that's most days of the week. And then as we bring the other part-time EMTs on, we'll supplement that also and be able to bring that ambulance out. So in an effort to try and keep the volunteers safer and healthier at this point. So just for a little while, they want to come out bad, they really do. And God bless them, they're the heart of our system. But we just try to keep them safe for now. Okay?
Appreciate it.
Thank you, gentlemen.
Thank you.